You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. We've had him on the program before. He is the busiest implant dentist in all of Montana, and we're glad to have him back, Dr. Matt Larsen. Dr. Larsen, welcome to the program.
Well, thank you. I'm glad to be back. I love coming down here, and I get excited every time I get to come meet with you. You never change at all. You still are just as young as you have every time I come in.
Well, thanks. You too. Now, I know you brought a stack of photos, and we'll try to get to as many of those as possible. But one of the things you told me on the phone when we visited recently, you said, everything has changed with the way I'm doing it today. It's much different than I was doing it in the old days because I met you about 8 years ago. So what's different? I mean, why is it better now than it was back then?
Well, like I said, everything's different. And what I mean by that is back when I was here before, we were doing a lot of surgeries. We were doing a lot of implants. But we were still doing it the same way that everybody else is doing it. We were still putting the implants in. We were doing a conversion. So we were pre-making a set of teeth. And then we'd put holes in it and we'd try to fit it over the implants and try to make everything line up. And then we'd try to grind the bite in and get all that stuff working good. And we'd be pinning stuff and doing all that. We don't do any of that anymore.
Did it take you a lot longer doing it that way? I
mean,
to get it right, it just took you a lot longer?
It took longer. It was messier. It was harder on the patient because they're spending more time in the chair, spending more time sedated, and kind of suffering through all these materials being injected in their mouth during this surgery. So it's an easier experience for the patient. It's cleaner. We're not putting anything down around where this fresh surgical site is anymore. Everything's done digitally.
What does that mean it's done digitally? You're planning it on a computer?
Yeah, it's all planned on a computer, but not only that, but we never take impressions anymore. You don't put goop in people's mouths. Everything's scanned in. Yep, it's a digital creation of everything that's inside their mouth.
Like what, you have like a little camera?
Yeah, it's a scanner. It's a digital scanner that goes in and records everything they have in their mouth. It will record their bite. If they have a good bite, if they don't have a good bite, we're going to help them and help develop a good bite, and then we're going to scan that and record it in the computer. So all that's done digitally, but that's not the coolest part.
Okay.
The coolest part is in the actual surgery, we developed a scan body. It's a little piece that fits on the implant while we're doing surgery that we put in there. We can scan it during the surgery, and that piece tells the computer exactly where that implant is. And then we send that up to the lab. They build a set of teeth.
You own the lab?
Yeah.
Okay.
I started a lab about 7 years ago. I love the lab part of it. And the advancements in lab technology, 3D printing, milling, amazing. I mean, we could talk about that for
the teeth in the next
hours,
room?
but yes, then we print those teeth. So we just scanned it in the patient's mouth. Nothing else happens in the patient's mouth, just this scanner rolling around. It goes up to the lab. The lab takes a pre-designed set of teeth that we've already designed on their digital face that's up in the computer in the lab. They adapt it to the implants, 3D print it. Those teeth come down, they're beautiful. Like we used to try to grind these things in, and we'd end up with these clunky teeth that we'd tell the patients, hey, just suck it up for the next 3 months. Like you're gonna have to wear these clunky set of teeth while everything heals. We don't do that anymore. Now, everything's scanned in the mouth, gets sent up to the computer. We've already built the teeth, okay? The clunky teeth, no more. Now the lab builds a set of teeth, just like we're going to build the final teeth.
Okay.
They adapt it to the implants, shoot it to a 3D printer. 3D printer prints it. We bring it downstairs. It screws in day of surgery.
So they walk out with upper and lower teeth that don't come out?
Yes, they walk out with upper and lower teeth that don't come out. We couldn't do that before. We didn't have the materials. The technology wasn't there. 3D printing, the advances in 3D printing and materials that we can 3D print is huge. We used to just print these little plastic doohickeys, like little Lego plastic things.
Yeah.
But now we have all different sorts of materials. We can print nano-ceramic materials that we can polish to look like teeth that are strong, like teeth. So yeah, we can put teeth in their mouth that we can send them out into the world and allow them to chew and eat with without having problems, and they can smile right away. I have to tell you, I know you're wanting to ask me something, but my favorite patients, people that wear dentures, and I tell people this all the time. People that wear dentures, we change their lives. I know that sounds cheesy, but in one day, we plan everything out. The day of surgery, they walk in with dentures in their mouth that are clunking around.
Yeah.
They can't eat. They walk in. When they walk out, after the surgery. They have teeth that don't move.
So they can literally, like, let's say a denture wearer is watching this, okay, in a perfect world. They come in, they meet with you. You determine whether they're a candidate, take some imaging. The next visit, they get their new upper and lower teeth that don't come out.
Yeah.
Is that true?
Yes, and
That's
I
not an
love
overstatement.
It. No, I'll tell you this story. This guy comes in, old cowboy guy, and he has his dentures. We take him out, we put his teeth in. He's kind of coming out of sedation, so he's a little bit confused. And he all of a sudden he says, "Doc." He's like, and I'm like, "What?" I'm thinking there's something wrong. I'm like, "What?" He says, "Well, you left something in my mouth." I'm like, "What?" And he grabs his teeth and he starts jerking on his teeth, like literally pulling his head up and down.
Yeah.
And I'm like, no. I said, "Those are your teeth." And I gave him a mirror, and he's like, "Those are amazing." He said, "Those look so good." And then he falls back asleep. He did that like 3 more times before we gave him to his wife to take him home. But
now, is this fair to say? This is not how it's normally done, right? Throughout the U.S. Correct me if I'm wrong. The way implants are typically done is you go to one doctor that does the surgery, places the implants, another doctor that puts the teeth on top, and another place that makes the teeth, and then they get them maintained elsewhere. So you do all those 3 parts right there. Is that why you do it so quickly?
yeah, well, we can do it quickly. Also, there's a huge cost savings to the patient. It's not only faster to the patient,
Okay.
but because I do it all together, if they have to go from a dental office, they have to go to an oral surgeon or a specialist or a periodontist, somebody to have implants placed, and now things are going back and
So what
forth.
do they like more? Well, obviously they want to be out of pain, but what do they like more? The way it looks or what they can eat? Because now they can eat anything, right? When you have bad teeth, tough to eat.
That's hard to say. They love being able to eat whatever they can eat, whatever they want.
Okay.
What people don't realize, especially, again, it's my denture patients. Like denture patients come talk to me because it's such a big difference. We get people that come in that have dentures, and they come back to me a year later, and I ask them, I say, "Well, how's it going?" "It's going great." "What can you eat?" "I can eat anything I want." "How is it different?" Well, let me tell you, I didn't realize that when I went out to a restaurant, I'd open the menu and I would look through, what can I eat? They said, I never opened a menu and looked for what I wanted. I never looked at what I thought was going to be delicious.
Okay.
I looked at what can I eat with my teeth in front of other people. And they said, I don't do that anymore. I go in there and if I want the prime rib, I get the prime rib.
Did they have regrets? Like they say, "Man, I should have done this earlier." Because you were telling me people like usually they hate their teeth for 10 or 15 years before they come see you. Is there truth to that?
Absolutely. And there's a lot of truth to it. It's a little sad. Probably the oldest patient I've done this on was 92 years old.
Why would a 92-year-old want to do this?
The same reason anyone else wants to do it. Just because they're 92, they still want to eat.
Okay,
They still want to be
fair.
able to enjoy food. They still want to be able to smile.
They're not more likely to fall out if you're 92?
No. The bone's actually really dense. If they've got good bone, they're good candidates.
So if a
for it.
75-year-old says, "Hey doc, I'm probably too old," that's
Let me
not
tell
old
you.
at all.
Let me tell you a story.
Okay.
I had been a patient of mine for years. Actually had really good teeth. He got dementia, and he went into a home, and they had him in the home. Nobody knew what was happening with his teeth. We didn't see him for about 3 years. One day the caregiver brings him from the home. He comes in. We take X-rays. His teeth are just bombed out. Nobody's been taking care of him. He can't, and he has cavities everywhere. And so he's got this toothache. What do? We pull the tooth. We send him back to the facility. About 2 months later, he's in again. We pull a tooth, back to the facility. About 3 months after that, I get this weird consult, and I get called to the consult room to talk to this big group of people. Turns out it's his family.
Okay.
And his family came in and they said, "Hey, we're going in to visit Dad, and he's miserable. He's always complaining about his teeth. He's always having teeth problems. They look terrible. What can we do?" And I said, "Well, they're not taking care of his teeth. There's not a lot that we can do." And I'm thinking about this from my perspective, thinking he has dementia. He doesn't really have a great quality of life. And they said to me, "What would you do if it was your dad?"
Okay.
And I'm
Wow.
like, that kind of set me back. I thought, well, I don't think about money when I think about my dad. I think about his quality of life and what's the best thing I can possibly do. I said I'd take his teeth out, I'd put dental implants in. They're like, "We want that." I'm like, "Well, let's talk about the cost. Let's talk about like his medical condition and all this stuff." And they said, "No, we want that. What is it going to take?" And we talked about the cost. We actually brought an anesthesiologist in to help because he had dementia, to sort of help with the sedation and make sure the procedure was comfortable for him. We did the dental implants. We did the teeth. We've had zero problems with him.
And now he can eat whatever he wants.
Yep, they bring him from the home once a year. I still see him.
That's nice.
The last time he came in is the first time he didn't recognize me. I had to talk to him for a few minutes before he kind of remembered me. But really a cool story. And a lot of people would say, okay, you just treated a patient that doesn't have a real high quality of life, that's sort of on their way, the final stages of their life. But should they have less quality of life than all the rest of us? Should they not have the same opportunity? And his family said he should. His family said, we're doing this. We love our dad. We're doing this.
That's good.
A great story. And love the guy. Still comes in. He's still hanging around. He's had those teeth for a couple years. Guess how many cavities he has? Zero. Yep, you can't get cavities on dental implants. And so we've given him something that helps him overcome the obstacle that he has being in that home and not having the care that he should have.
That's very nice. It's good story. Now you brought some photos. Let's
I
take
did.
a look
Yeah,
at some of the
yeah,
photos. And we are a little short on time, so I'm going to rush you a little bit, but this is good stuff.
Okay. Well, let's start here.
Okay.
This is, she's become a good friend of mine, Kendra, a young patient, relatively young for the type of treatment that we're doing. I would say the majority of patients are a little bit older that we're doing this treatment on, but there are patients that through no fault of their own have a medical condition that affects their teeth, or they're on medications that cause their mouth to dry out, that cause them to be more susceptible to decay.
Is that what's going on with her? She was losing her teeth?
Yeah, and so she's losing her teeth. So when she came in, she didn't know what we were going to do. She hated her teeth. She knew they were terrible. She had pain from her teeth all the time. And we had a conversation, and I said, listen, I don't think that we can save your teeth, okay? I think that maybe what we need to do is start over. You've got so much decay. You've got so much infection in your mouth. We have to get rid of all of that and get into a healthy state so that we can build back up something that you're going to be proud of and happy with. And when I was looking at her teeth, I got excited because one of the things she didn't like is she had kind of a gummy smile. And in the picture, you don't see it because she's not smiling very much with her bad teeth. But when we had her smile for her pictures, she had a real gummy smile. I can fix that. You know, and she told me.
So she would have been in a denture. Let's say if she went to another office.
Absolutely, yeah. I would say probably the majority of offices, that's the conversation they would have had with her. A denture. We couldn't save her teeth. Nobody could have saved her teeth. There was nothing you could do. And
so I interrupted you, but you said you got excited because you kind of knew where this was going.
I got excited because I knew what we could do for her. I knew that, one, we can get rid of all of the pain that she's having. We can get rid of all the infection in her mouth, all the decay. We can fix all that. But two, I knew that we could build her a set of teeth that she was going to love, and that her smile was going to look amazing. Everything she didn't like about her smile and everything that she communicated to us, we can fix that.
Let's take a look at the after. Wow.
Yeah. What do you think? How does that look?
She looks much different, actually. More sophisticated.
Yeah, she looks great. And what happens is people, when they have bad teeth and they meet people or they talk to people, they know what people are thinking. They know that I've had.
Do they feel judged?
Yeah, I have patients tell me all the time. I can tell the moment when I meet somebody new. They say I can tell the moment that they notice my teeth.
Really?
I try to hide it. I try to talk in a certain way that my teeth don't show. But the moment they notice my teeth, their face changes. Their interaction with me changes.
Right?
And people say this all the time. And I'm sure that it's...
So when she sees her face in the mirror for the first time, what's that like?
It's amazing. Most times with something like this, they get teary, they get emotional. We do have them sedated during the surgery.
So they're a little out of it.
Yeah, so the emotion is kind of, it kind of gets mixed up with that a little bit. But they love their teeth. What she did afterwards is she blew up Facebook. Our Facebook account, like she was posting pictures of her all the time, like smiling pictures with friends smiling. And if you pay attention to the two pictures, the before and after picture, you'll notice in the after picture, it's not just her teeth that have changed. If you look at her face looks healthier. Her hair is done. She has some makeup on. When people fix something about themselves that's been bothering them for a long time, it makes them care more about every other part of themselves. It's all connected. Randy, I kind of set this up. This is not the typical patient that we see. But you know what? The result is typical. Whether we have somebody that's 65, 75, 85, we see the same thing every time. When you take away that inhibition in their life, that thing that they're constantly worrying about. We see people become more charismatic. They're smile. We see people smile that never smiled before, and it changes their
Are
whole
husbands
personality.
and wives doing this, or people that have partners? Did they ever send one person in first, the second one?
We've actually done a lot of that. We call it the canary in the mine shaft. The one spouse will send the other one in, and if everything turns out right, then they do it. And we've done a lot of those. That husbands and wife, they both have beautiful teeth now.
Very nice.
They work out good. Let's go to the next one.
Okay, let's take a look.
Let me. This is a friend of mine that I met. So if you look at this picture, that is his smile.
Is that right?
He smiles with his mouth closed. I thought he didn't like me. I thought he was just grumpy.
Okay.
I do the same thing. You know, I see somebody that doesn't smile at me and they're looking at me with their mouth closed, their lips tight. I thought he didn't trust me or didn't like me or something like that. And what I found out, he didn't have teeth. He had dentures made, hated the dentures, couldn't wear them, so he never wore them. He went 3 years.
He had dentures, never wore them.
Never wore them. Couldn't stand them in the mouth. They hurt.
Okay.
Didn't wear them. 3 years. His wife saw my show, saw the show that we did.
Yeah.
She tells him, you got to go see him. She makes him an appointment.
So his wife had to drag him in.
Yeah.
Is that common?
Yeah, all the time. We get people, the thing is people get embarrassed, they get ashamed. They don't want to call. They won't call. They feel like they're going to be judged. A lot of times it's a spouse that calls and makes the appointments.
Okay.
A lot of times they come with him. His wife came with him, brought their little kids with him. He's got a great family. And everybody thought that he was just a grouchy guy. We took all of his information, one visit. He comes in, it's our denture patients. In one visit, we're going to take him from no teeth, not smiling, to him having a beautiful set of teeth. Him smiling all the time. He smiles all the time now.
Doesn't even look like the same guy, by the way.
No, he did a commercial
He looks
for
younger,
us.
too.
Yeah, he looks great. He looks
a commercial
great.
for
His
you?
wife's happy. Yeah, he's happy. Like he was so happy. And now every time he comes in, you can't help but notice because he's smiling and he's talking and he's laughing all the time. I think that's who he really is. That's who he really was. Even when he looked like that and he seemed like he was a mean, like grumpy guy, he wasn't a mean and grumpy guy. He's a great guy. He's a nice guy. He's a family man. He's
How
friendly.
long did he have a denture like that and was miserable like that?
He did
About
I don't know
more than 5 years?
I don't know how long he had the denture, but he had no teeth for 3 years. He had not worn his denture for 3 years.
So in one day, this guy gets it.
One day he has teeth, and he can't take them out.
Very nice. Very nice.
All right, let's get to another one here.
Wow. Okay. Is that unusual to see teeth like that?
It is unusual, and it's unusual for you to see teeth like that. It's unusual for the average person. It's not unusual for me. The problem is when people have teeth like that, they do not show them. When you look at teeth like that, you're going to hide them. And people do, and they find really clever ways to hide them. They find ways to smile sort of crooked, this little gimpy smile, and try to not show their teeth. And when they do show their teeth, they get a reaction every time from people.
So was she another person that her option would have been a denture?
Yes, her teeth were all coming out.
Okay.
Her teeth probably should have came out a long time ago. But she didn't really like going to the dentist. She sort of avoided it for a long time. She was nervous of the dentist judging her, making fun of her. Like she had all these things that she was worried about. When she finally came in, we're like, no, like we can fix this. So what do we do in a case like this? It's easy. We scan everything in. We put it all together in one day. You look at the after picture, one day. We go in, we take all the teeth out, we clean everything up, we get rid of the infection.
Most of these people are IV sedated, right? They're numbed up with a little IV sedation. So they have like a little memory of the whole thing?
Yeah, they typically don't remember anything from the surgery. A lot of people are kind of in and out through it, but yeah, we don't want them being a part of it. So Randy, take a look at that after. What do you see? What's different?
She looks younger, different, more sophisticated. I always think you're exaggerating. Like when we're talking on the phone, Randy, it's life-changing. I could see where
it is life-changing. I always tell people, I know I make it sound like snake oil. It's like it cures everything.
Because you love this.
I do, because it does. Like it makes such a big difference. And if people just could understand, I always tell people, if you could test drive these, you would never
go
wait.
back.
Yeah, you would never wait. And I tell them the same thing about a denture. If you could test drive a denture, you would never do that. You would do the fixed implant bridges every time. Because if you could tell the difference, you would never choose this.
Now, I should say this for people tuning in. I'm not trying to side with you. I'm just asking the questions. But I'm a little bit in the know. I mean, our program airs throughout the United States. I mean, the way you're doing it is rare. It's very unique that you have a setup and a lab and everything right there. Because there are some places take up to 2 years to get into your snap in, snap out teeth. I kid you not, right? And you're giving them new teeth in as little as 3 appointments. Is that correct?
I wish I could show you our lab. Our lab's beautiful. We have 3 big CNC mills. We mill titanium. We mill any
that
dental
means
material.
you're making the teeth right there.
We do everything right there. We can make every single part of it. We
You
make
hang
all of
out
our
there on your
surgical
day
guides.
off. Is that true?
It's not really a day off. You like to say that. I love working in the lab.
But you say you don't consider it work. I think is what you said.
I don't consider it work because I love it. I love being in the
very
lab.
nice for you.
I love building these smiles. It's such a complex process. I enjoy it. Let me show you this next patient.
All right.
You're going to like this because we just
That's
kind of talked about
interesting.
this. Again, this patient recently married, went through her wedding photos with her new husband, hated him. She was crying because of her teeth in her wedding photos. Her husband said, "We're fixing your teeth. Let's go." Brings her in. Same thing. It's a lot of times it's hard for people to overcome the barrier of making the appointment and coming in. But when somebody that loves them and cares about them sees the pain that they're having, they jump on board. They're like, "Let's get in there. Let's fix it." He brought her in. He said, and he told me, he said, "I don't care what it costs. We're going to fix this. I want her to have teeth that she's happy of." On her, we gave her a brand new set of teeth. We got rid of we got rid of all the bad stuff. We got rid of all the broken teeth, the infection. We gave her a brand new set of teeth. We gave her a brand new smile.
That's a different look, by the way, for sure.
Yeah. What do you think?
I think it looks good.
Yeah. It totally changes.
I mean,
her
anybody would
appearance.
agree with that.
And same thing as all of them.
She's got to be thrilled with that.
Yeah, she loves them. And we see this over and over. And we see this, like we were talking about, we see it with our 80-year-old patients.
Now, you're all over the internet, by the way. We looked at your online reviews. They're excellent. Do you ever get recognized around town?
Oh, yeah. This guy, Brian. Now, Brian is another one. Had great teeth. Had some medical issues. Okay. Had some things he had to go through, and through the process, ruined his teeth. Had decay everywhere, broken, missing teeth, pain. You know what we did for him? I bet you can guess.
Gave him a brand new set of upper and lower teeth that don't
Brand
come
new
out.
set of upper and lower teeth. Yeah.
Did they ever say, "Hey, I don't want a denture"? Did they ever come in on the consult and say, "Doc"?
Almost all the time.
Really? Okay.
Because most of these people know somebody that has a denture, and they hear what they say. They hear the complaints that they have. They hear the problems that they have, and they see it. I had a lady come in my office, okay, and this was a powerful story for me. She came in my office, started crying, starts telling me this story. She can barely get it out. She's at the restaurant with her husband. They're with friends. She has a snap-in denture, snaps onto 4 implants, and a seed gets under her denture. And so she's sitting here trying to talk to her friends and her husband while this thing is cutting into her gums underneath the denture. And after a while, she realizes, I've got to go get this out. She excuses herself, goes into the restroom to find a private place to take the denture out, rinse it, and put it back in. She goes into the restroom, okay? It's like a society meeting. It's full of women in there chatting and putting on makeup and fixing things. So she goes to the far sink at the far side, tries to turn her body, take her teeth out to rinse them, and happens to look up in the mirror that's right in front of her, and she sees everybody in the restroom is staring at her, looking at her reflection in the mirror with her teeth out in the sink. And she says she put her teeth back in, hung her head, walked out of the restroom, went back down and sat down with her husband. As soon as they were done with dinner, she said, "This is it." She said, "I was humiliated.
I'm going to Dr. Larsen.
I'm not doing this again. We're getting this fixed." And
That's
she
nice.
came in to see me. And we get stories like that all the time. And
is there kind of a tipping point where they feel like, "I've had enough"?
They have to have that. There's so many people out there that suffer, that have dentures, that are miserable, that fight with their teeth, but they all have some point, something happens in their life that tips them. I try to tell people all the time, don't wait for that. Like, why would you wait for that? Like, come in, let's fix them now. Let's give you an extra couple of years of enjoyment.
Now insurance doesn't cover this. Medicare doesn't cover this. Medicaid certainly doesn't cover this, but you say people finance this.
Most people finance it.
Or at least a portion of it, right?
Yeah, most people finance it. It's something that they come in. We actually have some companies that we work with that help with financing.
You have to have okay credit, right?
Yeah, you've got a pretty good credit, but we've got a gal that's all she does. Is help people to be able to finance this, help them find ways, if they want to be able to get this done and to be able to find a way to be able to afford it for themselves. And
time for one more.
Okay, one more. This is Mike. This is one of my good friends. He has a lot of personality. Okay, this guy's a rancher. If you've ever watched the show Yellowstone,
Yeah.
like this is one of those kind of guys. Like he
Okay.
lives on a ranch out in the middle of the country, only a few miles from Yellowstone Park, actually.
Okay.
And nicest guy. He'd been wearing a denture for years. His denture had broke in multiple places. What do you think he did?
What?
He's a rancher. He just got along with it. And finally, after years of dealing with this and now having problems with his lower teeth, he comes in to see me and he's like, hey, what can you do for me? And again, I see a denture patient. What do I think? I love it. Because in one day, he can come in one day I can give him a brand new set of teeth, change his life.
Look at this smile.
Yeah, give him teeth that don't come in and out.
That expression is pretty good
Yeah,
too.
he asked to do a commercial for us.
Oh, he did.
Yeah, he loves his teeth.
So he can bite into a juicy steak.
Anything.
There's no limitations.
No, he can bite into an apple. He can bite into a steak. He can beef jerky, whatever he wants to eat. And as a guy that works with cattle and horses and on the ranch all the time, you know, he's eating some pretty tough stuff. You know, he's eating some stuff he kills, literally. So he needs some pretty strong teeth. And now, no restrictions. I asked him, I said, do you have trouble eating anything? And he laughs at me. He's like, I ain't eat anything.
Now, we're completely out of time. Let's just suppose somebody's watching this and they either have really, really bad teeth, they feel like they're going to end up in a denture, or they're currently wearing a denture. They've heard what you had to say, but they're still skeptical or they're still afraid. What do you say to them?
I say, don't wait for that trigger moment. Don't wait to be humiliated in front of other people. Don't wait until you can't eat. Don't wait until you're bringing your own food to the family reunion because you're worried you won't be able to eat anything that's there.
Okay.
Give me a call. Let's just talk about it. Maybe it's not something that you can do right now, but let's talk about it. Let's come up with a plan.
That's good.
Let's look into the future and let's find a way to make this happen.
Do they get to meet you on these consults?
Every time. Yeah.
Very nice.
I'm always there.
So if somebody wants to make an appointment, do you prefer they go to the website, make an appointment there, or just call your office?
Just call the office is probably the easiest way to do it. Okay. You can from the website, whatever you prefer. A lot of our patients, the technology's maybe a little struggle for them. They like to pick up the phone and talk to somebody. And that's a great way to do it. You can also go to the website and fill out a little form and get a consult through the website too.
Dr. Larsen, excellent, excellent stuff. Thanks again for coming back on the program.
Thank you. Thanks for having me.
You've been watching the Wellness Hour news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.